Central line-associated bloodstream infections, or CLABSI, occur when pathogens enter a patient's bloodstream through a central line. These infections occur within 7 to 10 days of catheter placement. Commonly associated bacteria include Pseudomonas and Candida. A central line is a catheter placed in large veins to provide medications or fluids or to collect blood. Central lines run close to the heart and remain in place for weeks to months. Improper insertion of a central line, insertion of multiple lines, the need for a central line for long periods of time, and unsterile cleaning of the site can lead to CLABSI. For this project, we focused on adults 18 plus who were admitted to intensive care units.
Those most at risk for developing CLABSI include patients with chronic illnesses, such as those with malignancies, gastrointestinal tract disorders, or pulmonary hypertension, patients who are in immunosuppressed states, patients suffering from malnutrition, and patients undergoing total parenteral nutrition. Additional risk factors include age extremes, loss of skin integrity, such as burns, and prolonged hospitalization before line insertion. The most common symptoms of CLABSI are fever and chills. Patients may also experience pain, swelling, and discharge surrounding the exit site. CLABSI is most commonly diagnosed via blood culture, followed by complete blood count, serum electrolytes, and liver and renal function tests.
CLABSI is estimated to be the 8th leading cause of death in the U.S. CLABSIs lead to longer hospital stays, death, and higher healthcare costs. Patients with CLABSI can have their hospital stay increased by up to 3 weeks. 18% of cases are fatal, with 28,000 patients dying from CLABSI each year in the U.S. Because CLABSIs are preventable, the Centers for Medicare and Medicaid Services don't pay hospitals for costs associated with CLABSIs. If the incidence of CLABSIs can be decreased in the ICU, the healthcare system and hospitals can save both lives and money.
Nurses can prevent infection by waiting for the skin prep agent to dry completely before inserting any central lines. In addition, the nurse is recommended to apply appropriate skin antiseptics. Sterile barriers such as sterile gloves, sterile gown, cap, mask, and large sterile drapes should be utilized to prevent the patient from getting infected. Other interventions nurses can follow include following central line maintenance practices, as well as washing their hands with soap and water or using an alcohol-based hand rub before and after touching the line. Removing the catheter as soon as possible decreases the patient's chance of getting an infection.
It is important for both nurses and patients to be educated on preventative interventions for CLABSI. Patients should educate themselves on the incidence rate of CLABSI in that specific hospital they are being treated. They should inquire about why the central line is necessary, how long it will be needed, and what possible signs and symptoms to watch out for to prevent CLABSI. If the dressing around the central line becomes loose, a change in appearance, such as redness, wetness, or soreness occurs, then it is pertinent to notify a healthcare provider as soon as possible. Patients should limit touching and not allow visitors to touch the tubing. If and when someone must touch it, then the patient should inquire if they have done proper hand washing first.
CLABSI should be prevented at all costs for patients. Now that we know who is at risk and what modifiable risk factors there are, it is necessary for the medical team to take measures to prevent CLABSI. No longer should CLABSI be a leading cause of death within the United States. Let's improve the standard of care for our patients. Through education, intervention, and proper hygiene practices, we can save the lives of future ICU patients.